Welcome to Doctor Health Hub, where every episode begins with a doctor tip you can trust. Today we're talking about a very common lung problem that many people have heard of but still misunderstand: asthma. What is it really? Who gets it? What causes it? What are the signs? How do we diagnose and treat it? And how can we prevent attacks?
Yes, this is an important one. Asthma can be scary when someone cannot breathe well, but with the right plan, most people can live very normal, active lives. Let's go through it step by step in simple language.
So, doctor, in easy words, what is asthma?
Asthma is a long-term condition of the airways in the lungs. The tubes that carry air in and out become sensitive, a bit swollen inside, and can tighten suddenly. This makes it hard for air to flow out, so people feel tight chest, cough, wheeze, or shortness of breath. The key point: asthma comes and goes. Symptoms vary over time and often appear or get worse with triggers like infections, dust, smoke, cold air, exercise, or strong smells. Between attacks, some people feel almost normal, but the airway inflammation can still be there.
Who usually gets asthma? Is it only children?
Asthma can affect anyone. It is common in children, but many adults have it too, and some people are first diagnosed as adults. Risk is higher if there is family history of asthma, allergy, eczema, or allergic nose problems. People exposed to smoke, air pollution, dust at work, or repeated respiratory infections can also have higher risk. So it is not just a kid disease, and it is not a week-long label. It is a real medical condition across all ages.
What causes asthma or triggers it?
There is no single cause. Asthma is usually a mix of genetics and environment. Inside the lungs, the airways are more reactive. When they meet a trigger, the muscles around the airways tighten, the lining swells, and thick mucus can form. Common triggers include viral infections, pollen, dust mites, pets, mold, smoke, perfume or chemical fumes, cold air, and exercise. Some people get work-related asthma from chemicals, flour dust, cleaning products, or other exposures. In many patients, allergies and asthma travel together.
What do asthma symptoms look like in daily life?
The typical symptoms are cough that comes and goes, often at night or early morning, wheezing, a whistling sound when breathing out, tightness in the chest, shortness of breath, especially with triggers or infections. These symptoms often get worse with a cold, when laughing, running, being around smoke or strong smells, or during certain seasons. A key clue: symptoms vary and can improve with asthma medicine.
If someone has these symptoms, how do doctors confirm it is asthma and not something else?
We listen to the story carefully first. We look for repeated symptoms, triggers, and times when breathing is worse. Then we use tests to support the diagnosis. The main test is spirometry. You blow hard into a machine to see how fast and how much air you can push out. In asthma, we often see narrowed airflow that improves after using a bronchodilator medicine. That reversibility supports asthma. Sometimes we repeat lung tests at different times or use peak flow meters over days to see changes. In some cases, more special tests are used by lung specialists. We also look for other causes like heart disease or COPD, especially in older adults or smokers.
Once asthma is confirmed, how do we treat it? Can you explain in simple ways how daily treatment and attack treatment work?
We have two basic ideas: control the swelling and open the airways. First, controller medicines. These are usually inhaled corticosteroids, sometimes combined with long-acting bronchodilators. They calm the inflammation inside the airways and reduce attacks. They're taken regularly, even when you feel okay. They are the backbone of modern asthma care. Second, reliever medicines. These quickly relax the airway muscles and ease symptoms. Some people use a short-acting inhaler. Many current guidelines prefer using an inhaler that includes both a low-dose steroid and a fast-acting bronchodilator together for safer relief, especially in adults and older children. For more severe asthma, there are extra options: higher doses, add-on tablets, allergy treatments, or biologic injections chosen by specialists. Very rarely, in severe cases that do not respond, other procedures may be considered by specialists. Good inhaler technique and a written asthma action plan are just as important as the medicine itself.
What about during an asthma attack? What should treatment look like then?
An asthma flare is when symptoms suddenly get worse. More cough, more wheeze, chest tightness, trouble speaking in full sentences, using neck muscles to breathe, or lips looking blue. Mild to moderate flares are often managed with repeated doses of reliever inhaler as written in the asthma plan, sometimes with a short course of steroid tablets guided by a doctor. For signs of severe attack, need urgent care. Struggling to breathe, cannot speak in full words, reliever is not helping, bluish lips, drowsiness, or previous ICU admission for asthma. That person should go to emergency immediately. In hospital, treatment can include oxygen, frequent inhaled medicines, steroids, and sometimes more advanced support. If breathing fails, intensive care and ventilatory support may be needed. That is invasive and used only in very severe, life-threatening cases.
What complications can happen if asthma is not well controlled?
Asthma poorly controlled can lead to frequent attacks and emergency visits, missed school or work, trouble sleeping and constant fatigue, limitations in exercise and daily activities. In severe cases, life-threatening attacks and respiratory failure. Over many years, chronic inflammation may cause lasting airway changes. But with good control, many people avoid these problems and live full, active lives.
Now for the part many people ask: how can we prevent asthma attacks or reduce problems?
We focus on control, not cure. Take your controller inhaler as prescribed even when you feel well. Check and practice your inhaler technique with a nurse or doctor. Know your personal triggers and try to reduce them. For example, smoke, strong perfume, heavy dust, some pets, or burning incense. Do not smoke and keep your home as smoke-free as possible. Stay active with safe exercise. Fitter lungs cope better. Keep up with vaccines recommended by your doctor, especially flu and, when appropriate, pneumonia and COVID vaccines to reduce infection-triggered attacks. Treat nose allergies or reflux if they make breathing worse. Have an asthma action plan: what to do when symptoms increase and when to seek urgent care.
Can you share simple do and don't points for someone with asthma?
Do take your preventary inhaler regularly if your doctor prescribes it. Do carry your reliever inhaler if you're prone to attacks. Do learn proper inhaler technique and review it from time to time. Do notice patterns. If you are using your reliever more often, talk to your doctor. Your asthma may not be under control. Do seek urgent help if you are struggling to breathe, cannot speak in full sentences, or your reliever is not working. Do not ignore frequent night cough, wheeze, or using your reliever many times a week. That is a warning, not normal asthma. Do not smoke and avoid people smoking around you. Do not stop your controller inhaler suddenly just because you feel better. Do not rely only on home remedies or herbal products for serious symptoms. Do not wait at home with severe symptoms, hoping they will go away.
For someone watching who has asthma or has a child with asthma and feels worried, what is your final message?
I would say asthma is real, but it is also manageable. With the right diagnosis, the right inhaler, good technique, and a clear plan, most people can study, work, exercise, travel, and live fully. The danger comes when asthma is ignored, undertreated, or when people wait too long in a severe attack. Work with your doctor or lung specialist. Ask questions until you understand your plan. Good control is possible, and you deserve to breathe confidently.
Thank you, doctor. And to everyone watching, this video is for education only. It follows the spirit of major asthma guidelines, but it is not personal medical advice and not a reason to change your treatment without talking to your own doctor. If you have breathing trouble, repeated cough or wheeze, or concerns about your asthma, please see your doctor or local clinic for a proper check and a safe plan. Your health is your wealth. Stay tuned for the next doctor tip you can trust.